Hi to those of you who follow Standing Up to Multiple Sclerosis naturally and alternatively. I'm not so sure that everybody who has recently added to the page and who I've become friends with knows the full story, and I just said I'd talk a little bit about it today, seeing as I'm out of hospital and very now recharged and focused about getting back to healing the damage that was caused by a lot of IV steroids. My MS in the beginning was like an aggressive relapsing remitting, and that was treated with very high doses of IV steroids, maybe up to 3, sometimes 4 times in 1 year. The mainline drugs weren't working. I did the intrabator ferons, I did the Copaxone, and then I was, it was about, I can't remember now how many years ago, but it was when one of the oral therapies had just come online, and it was only available to people in my area, my district, who had private insurance. And at the time, I was very much in that mindset that the only thing that could help with MS, the only thing that could possibly give me a really good quality of life was the MS disease modifying drugs. I had never, when I was diagnosed in Dublin, he was a professor of neurology. He gave me 3 pamphlets, and there were 3 disease modifying drugs, and strongly recommended that I go on one of them immediately. And nobody ever kind of broached the subject of treating the disease with food, alternatively, naturally, holistically. It was straight in with the disease modifying drugs. And when you're very scared, my son was only 3 years old when I was diagnosed, and when you're told that there was a very rapid progression of lesions in the first 6 months, you turn to the people who are there to treat you, and that who you put all your trust and your faith in. So I actually went on the radio and I spoke about getting this particular drug made available for people who were on medical cards and who didn't or couldn't afford private health insurance. And I was then one of 5 in the Midwest of my like the region, Limerick, to be put on this drug. The doctor sat me down, the neurologist sat me down, and he did say there were two, it was a high-class drug with 2 high-risk side effects. One was macular degeneration, and the other was it could affect your liver and damage your liver and cause problems and issues with liver enzymes. And there was, I had to read all of that. I had to have a family member sign it and go through it with me, because I have a lot of frontal lobe lesions. But anyway, it was decided that it was the best way to go, because my MS was just going that way really quickly, and as I said, my son was still quite young, so I took the risk. I stayed on it for 2 years, even though my liver function enzymes were going up and up and up all the time. I still was just hovering under the FDA cutoff point. My dog. The FDA and the pharmaceutical company had a point where if your liver enzymes reached that point, you had to be pulled off it. And I hovered just below it. I even went above it sometimes and came back down again. And I insisted, I begged and I pleaded to be left to stay on it, because it was working. In the 2 years I was on it, I had minimal progression of lesions, and I was very, very well while I was on it. In one sense, I was very well MS-wise. The other side to it was infection. It made me immune depressed, not suppressed. So now, looking back on hindsight, when I look back, I had a lot of infection. I was constantly had viral pneumonia, I had UTI infections, like kidney infections, like chest infections, every infection going. Anyway, long story short, it began to damage my liver, and I then was told I failed the drug, and I stopped taking it, and I went into a very bad depression, because I felt I'm JC positive. I couldn't go on Tysabri. It wasn't an option being JC positive, and my history of shingles and cold sores and whatnot. So I just felt that's it. It was just going to just go downhill now very, very fast. Then I met Ian through a discussion board about healing MS, treating MS, curing MS even, just with nutrition basically. and he is of the school of thought where, and there's quite a lot of people who believe that MS it begins in the gut. Okay, it all starts in the gut. The stomach is the second brain, and there's huge amount of work been done on the leaky gut. There's a lot of books been written about it, and that school of thought has become very, very popular in the last number of years. So the leaky gut. So he, even though I had quite a bad chest infection at the time, he urged me to try just a very simple thing. It is garlic, lemon, ginger. We call it GGL, and you just basically just take the just wash them. Ideally, if they're organic, great. You put them in as they are, cut them, put them in, blend them, get a sieve, sieve everything out, get as much as you can out. You can even put the pulp back in, re-sieve it, put it back in, and that's your GGL. You leave it in the fridge, take it out in the morning, and you have it at room temperature. And for 3 years, I did not have an infection, not one. I went through the summer, winter, I had bronchitis gone completely. I haven't had bronchitis in maybe 4 years now, and all I took was the GGL. I got to about the 5th day and I was like, no, it's not working, I need to go, I need my antibiotic, and it got to the 6th day and I have never looked back. Then things get busy and things happen, and I'm moving, and just there was a lot of things going on, and I forgot about my GGL. I started to look. I was doing other things, looking after other things, and turns out when I was in hospital for 5 days, it was a stomach infection that I had, and a gallbladder infection. So because they were ultrasounding the gallbladder, then they found out that I have a stone in the neck. I'd actually passed a stone, and that's what brought me to the accident and emergency, because the pain of passing the gallstone was it was very unpleasant. So then they found out that I have gallstones, and I have a stone, a fairly big stone in the neck of the gallbladder. So they said I would need to have my gallbladder removed, and I just said I needed some time to think about it and look into alternative ways of maybe looking after that. I also discovered that I have fatty liver disease. A lot of people do, they don't know it's non-alcoholic fatty liver disease. But I asked the doctor, one of the younger doctors, is it possible that, and also they found out I have gastritis. It's when the lining of the stomach becomes very inflamed and it can be very sore, and that can cause an awful lot of pain in the stomach. So I had all that going on, and ironically enough, they said it can happen when you're trying to lose weight, and it can often be something that brought to the fore. It didn't happen in the last 6 months or year. These gallstones and the fatty liver, it can take 8 years. Incidentally enough, I was on disease-modifying drugs for exactly 8 years, and in the past couple of years I do eat very, very healthy. I try to have a vegetarian and a vegan diet when possible. I'm not vegan, I'm not even vegetarian, but I do try throw them into the week. So I just realised, I thought, why would I all of a sudden get an infection in my stomach and in my gallbladder? And then just the little light went off, and it's like everything else. People buy supplements, they buy, you read about something like ginger and lemon is good to drink in the morning, or the apple cider vinegar, and we do it for a little while, and then we feel a little bit better and we forget about it. So I have decided that I am going to do a liver and a gallbladder flush and cleanse first, before I would even consider going down the road of surgery. It's not ideal, obviously, when you have MS, because you have the whole anaesthetic thing to deal with. So I'm going to go back to my GGL, my garlic, my lemon, my ginger. All I can say is that the minute I stopped doing it, I end up with an infection in my stomach. And while I was on it, no bronchitis, no UTIs. It's so simple that you think, how could something so simple work? But it does, and it did, and I'm back making it again today, making a big batch of it. And the other thing then I will be doing is which I continue to do, is the apple cider vinegar. And my other half very kindly had this waiting for me when I came home. It's called the Liver and Gallbladder Miracle Cleanse. And I was reading it this morning, and it just blew my mind so much that I said I had to do this little video. And it says as follows: if you suffer any of the following symptoms or similar conditions, you are likely to have numerous gallstones in your liver and gallbladder. And here goes as follows. I'll start at this one: asthma, headaches, migraine, joint diseases, arthritis, knee problems, osteoporosis, obesity, chronic fatigue, cancer, multiple sclerosis, fibromyalgia, and Alzheimer's disease. Then it goes on. I mean, there's a litany of things here, like the stiffness in your joints, skin, hair problems. There's just so many things. I found this one interesting: hormone imbalance, premenstrual tension, urinary problems, prostate disease. It's just where there's another one here: menopausal disorders. And you'll have a number of things like high cholesterol, heart disease, brain disorders, nausea, vomiting. That's what brought me to the hospital, was all that side of things. Depression, difficulty breathing, food craving. It's just mind-blowing. Diarrhea, constipation, and a hernia. I've a hernia as well, but anyway, that's another story. So I was reading through it this morning, and another thing that I thought was really interesting. I've been on a lot of IV steroids, and people always say, "Oh, you have weight and bloating and fluid retention." It's very hard to lose weight when you have been on so many IV steroids. But then I was eating so well. I was taking various things that were just, other people were losing weight really, really quickly on it. I was getting very, very upset and very disheartened. I do eat extremely healthy. I eat very well. I take the dog out. I get little walks in. I don't drink. I don't smoke. And I was getting really, really upset and really frustrated that just this weight. I went to the various different dieting clubs. I would lose 2 stone, back again, 1.5 stone, back again, and it was just like this the whole time. If you have fatty liver disease, if you have gallstones, you won't lose weight, because the toxins and the sludge, and actually one of the doctors said there was so much sludge there, so that's what I'm going to be doing. I'm going to be de-sludging my liver and my gallbladder, and then I feel anything then that I do going forward after that, I'm very, very positive now I'm going to see the results that other people were getting, because I was following it, I was doing everything I was meant to do, and it just wasn't happening. If your body is toxic basically, and you have all these fat cells going around, they just keep going around in your system, and they're not getting flushed out, and that's why a lot of people can't lose weight. That's why they lose it when they're on these diets, and then it comes right back up again. It's because the liver is sludgy and fatty, and because the gallbladder would have stones. A lot of people have gallstones. They don't know about it because they don't have the severe pain of, when a gallstone is passing, you have something going on, because it's very, very painful. Likewise, if one of the stones gets caught in the, I think it's called the biliary duct or something like that, you'll have jaundice and you'll have severe pain. And I had that horrendous bloating where I actually looked like I was pregnant, 9 months pregnant. You'll have all of that going on. And that would be very obvious then that there's something going on in the liver and the gallbladder. Like with the fatty liver disease, you'll have almost what they call like a basketball belly, where you'll have this awful, awful basketball belly, and it's due to the fatty liver and the inflammation and all of that. And you're saying, God, I didn't really eat very much today. I'm following this diet, I'm following this program, and look, I have this belly and this bloating and this very uncomfortable. Another thing as well for those of you with MS who are following this page is the fatigue element. Anything that we can do to help with neurological fatigue, it's just something that it's a no-brainer not to do it. We all know how horrendous fatigue is and how debilitating the MS fatigue is, but I just thought it was very, very interesting. My father had, very similar to what I have, my father had Alzheimer's. My mother ate the same food. We lived in the same household. It's just, I suppose maybe some people are predisposed to it, I don't know, but at least one of the doctors was open and honest enough to say that he looked and saw the medication that I had been on and that I tried quite a lot of the disease modifying drugs, and said it's very possible that these very hard medications have caused the problem. You know, when you're very ill and you're worried and you're grasping at straws, and you'll do whatever you need to do. It didn't work for me, it works for a lot of other people, but what I'm saying at the moment is, even if you are on these disease modifying drugs and they're working very well for you, it's very, very important to look after your liver and your gallbladder, especially if you're going to be on them long term. I think any of us who are on any of these medications for nerve pain, you know, the mixes of gabantons and tegratols and all of that. So I'm back now at home, and I'm, as they say, I'm supercharged to get this liver and gallbladder in optimum health, and I'm going to be kind of documenting my story as I go. I am getting ready to do the first liver and gallbladder flush probably in a few days. I just need to wait until the infection that I have in my stomach has settled down, and finish off some antibiotics that they gave me in the hospital. They did give me IV antibiotics and they worked. They did help with the infection. But once this blip is over, I'm going to be really, really looking after the liver and the gallbladder, and I'm going to document getting ready to do the liver and the gallbladder flush and how I feel after it, and hopefully I won't have to go and have the surgery. So that's it. All I can say is this is just a mind-blowing read. I'm sure there's lots of books out there that talk you through how important it is to have a very sludge-free, stone-free, toxic-free, chemical-free liver and gallbladder. And again, everything going back to the gut. The gut is the second brain. It's like, if you think about it, you know, if you're doing something or you're getting a little bit nervous, you get those butterflies in your tummy. So it just kind of makes that connection of, you know, the gut being the second brain. Just think of when you get nervous, upset, anxious. Some people, their tummy they get cramps and whatever. So that's it. I hope you got something out of today. If you haven't tried the garlic, lemon, ginger, and again, all of these are just excellent for detoxifying and purifying. I guess I found it a little bit too late. I had been on horrendous amounts of medication and didn't start to really look after my internal organs until, let me see, I was maybe 8-9 years into the medication. So I'd say if anybody's just beginning a disease modifying drug, if anybody's just starting those very strong nerve painkillers, look after your liver and look after your gallbladder and your intestines. You will definitely feel the benefit of it. I know I felt the benefit of the GGL almost instantly, but you know, hindsight is a wonderful thing. But we're here and now, and it's all about going forward. So I hope you'll follow me, and we'll see how things go. Very positive about getting better, feeling better, and let's hope it works. I really don't want to have that surgery. So have a great day, everybody, and hope you enjoyed it. Okay, bye.